Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pregabalin. Pregabalin or Progabide or also Gabapentin. All of them have similar actions. Pregabalin, Progabide and Gabapentin will act on alpha 2 delta receptors. These pregabalin, progabide, and gabapentin are actually anti-neuropathic drugs. They have anti-neuralgia effect. There is no drug interactions are seen between them. Okay, they do not interact with GABA receptors. They do not interact with GABA receptors. And but still they inhibit the uptake of GABA. They actually do not interact with GABA receptors, but they inhibit the uptake of GABA. Then they are important. They have a side effect. They can cause heavy sedation, and they can also cause weight gain as a side effect.
thank you and thank you for watching.